welcome back to our section titled Foundations of Nursing. We're going to take a little bit of time right now to talk about hospital-acquired infections. There are different types of infections that can occur in the clinical setting, and some of these can occur from catheter-associated urinary tract infections, meaning that we have a urinary catheter in our patient, and a urinary tract infection occurs as a result of that catheter because of poor hand hygiene or not maintaining sterile technique or not providing good care for that catheter once it's in place. There are also central line associated bloodstream infections. A central line is a line that goes into the patient either through their arm, a peripherally inserted central catheter. Sometimes it's inserted up into the chest. And again, these lines can cause bloodstream infections. We can end up having surgical site infections in our patients after a surgical procedure. And there's also ventilator-associated pneumonia. So we can have a patient in the intensive care unit who ends up with pneumonia after being placed on a ventilator. Some of the infections that occur in the hospital setting can be bacterial. Examples of bacterial infections include Clostridium difficile, Staphylococcus aureus, E. coli. We've all heard about MRSA, which is methicillin-resistant Staph aureus. But there are also viral infections that can happen in the hospital setting. Examples of these include hepatitis, HIV, influenza, norovirus, and COVID-19. These are all examples of viral infections. And so how is it that these hospital infections occur? We're going to take a little bit of time now to break down this chain of infection, okay? So this is a great poster that kind of talks about all of the different ways that the chain of infection takes place from beginning to end. And what we want to do as healthcare providers is work on breaking that chain of infection. If we can break that chain somewhere, hopefully then we can prevent the infection from occurring. And so, first of all, we want to know what the infectious agent is, right? So if we can quickly identify, diagnose, and treat either a bacteria, a virus, a fungi, or a parasite infection, that's very important. So we hear people refer to antimicrobial stewardship, meaning that it's important for us to know the type of bacteria maybe that is causing an infection so that we can use the proper antibiotic to treat that infection. So we've got to have an infectious agent, right, to start with, and then we have to have a susceptible host. And a susceptible host is any person, especially those receiving health care, right? So individuals that are in the hospital that are vulnerable to infection because of a surgical procedure, because of decreased immune function. We want to know that these guys are at a higher risk. They're a susceptible host. And so being aware of that is especially important. We also need a reservoir in the chain of infection. A reservoir is a person, can be a reservoir. You know, we can carry viruses and bacteria. Water is a reservoir for these things. Animals, insects, dirt, soil. But more importantly, in a hospital setting, dirty surfaces and equipment, which is why it is so essential to follow the policies and procedures for sterilizing the equipment that we use on our patients in the hospital setting. So breaking the chain for the susceptible host would be examples of things like making sure our patients have their immunizations, making sure our patient is immunized against influenza, against COVID, treating underlying diseases that can put patients at a higher risk, providing patient education, right? So teaching a susceptible host, which is what we said, any person, especially those receiving health care, to wash their hands and do things to help protect themselves as well. Breaking the chain in terms of the reservoir would be cleaning, disinfecting, and sterilizing our equipment, making sure that we are maintaining our infection prevention policies, and of course, pest control, right? Keeping animals or insects out of the clinical setting that can carry different types of disease. In order to have an infection take place in a susceptible host, we need to have a portal of entry. And a portal of entry can be a broken skin, any area of broken skin. This could include a pressure ulcer. This can include a surgical incision. Our respiratory tract is a portal of entry. Our mucous membranes, right? So like even our eyes, right? You've learned from ways to protect yourself against COVID. You've seen people with eye shields on, as well as shields over the mouth and the nose. And also catheters and tubes. So we mentioned earlier that a Foley catheter is a portal of entry for a bacteria to cause a urinary tract infection. And so breaking the chain for portal of entry, important for hand hygiene, washing hands, using personal protective equipment like masks and gloves and surgical gowns, our own personal hygiene, right? Caring for ourselves, having clean hair when we come to work, making sure our bodies are clean, first aid, and importantly here, removal of catheters and tubes as soon as they can possibly be removed. And so what I mean by this is that when, let's say when a patient comes back from a surgical procedure, you will see that there's very likely going to be a policy that we will have that Foley catheter removed as soon as possible and get that patient up and have them use the bathroom so that we don't have to keep that Foley catheter in, because we know that the longer that Foley catheter is in, the higher risk the patient will be to end up with a urinary tract infection. We also need to have a portal of exit. So in the human subject, right, if we have a portal of exit for that bacteria or that virus to get out of our body to then be transferred to another individual. And so a portal of exit would be open wounds on our skin and a splatter of body fluids, right, from coughing is a good example of this, or maybe we are, in some cases, we're cleaning out a wound with maybe the patient's getting pulsatile lavage where they're spraying a wound down, and while that's being sprayed, there's kind of like this splatter of fluids in the room. So it's very important that we're fully gloved and gowned appropriately with a mask and eye shield in order to prevent that portal of exit from infecting another individual. So breaking the chain again, good hand hygiene, use of protective equipment, controlling these aerosols and splatter, right? Respiratory etiquette. What do we need to teach our patients? We need to teach them that they need to be wearing masks if that's required. If they're not wearing a mask, that they would cough kind of into their elbow, that we need them to wash their hands frequently, and properly disposing of waste, right? So if we have linens or if we have any kind of soiled chucks or other things in the clinical setting, that we're properly disposing of them in the right way so that the infectious material doesn't get on other surfaces and get transferred to other patients. There also has to be a mode of transmission that can be a contact, right? So this contact can be direct or it can be indirect, and we're going to talk about the difference. There can also be ingestion of the mode of the transmission, can be done through ingesting something like a contaminated water or a contaminated food source, or just breathing in, right? We know that in the case of COVID, just breathing, right, the air around us can contain the virus, which then comes in through our mouth, through our nose, through our eyes, and then we get infected. So again, having patients that are needing to be on isolation because of an infection that they have is a really good way to break the chain. When we know that an individual has tuberculosis or has COVID, that we put them in a special room, that we isolate them from other patients, okay? So again, food safety, cleaning, disinfection, sterilization of equipment, good hand hygiene, and personal protective equipment. And it's not even so much that we're using the PPE, but knowing how to properly don the PPE, which is putting the PPE on in the correct order, and doff the PPE, which means taking the PPE off in the proper order, helps prevent spread of infection as well. And we will talk more about donning and doffing protective personal equipment in our skill series. So I said we were going to talk a little more about direct contact transmission. So direct contact transmission involves skin-to-skin contact. So this is a physical transfer of a microorganism to a susceptible host from an infected or colonized person, okay? And this can occur during nursing care when we're turning a patient, bathing a patient, or performing other patient care activities that require physical contact. That's why hand washing is so important in the clinical setting, and also using good infection control measures like properly wearing our PPE. Indirect contact transmission occurs when there's a susceptible host and there's a contaminated intermediate object. It's usually an inanimate object that's in the patient's environment. So this could be a stethoscope that has infectious material on it that I am then using on the patient. This can be from hair, this can be from bedding, and from skin. So these are usually inanimate objects. Even a bedside table can have infectious material on it in the patient's environment. And so we want to make sure that we are cleaning our stethoscope in between each use. So let's talk about hand washing. Hand hygiene is one of the most important ways to prevent the spread of infection, right? And we're going to talk exactly about what the CDC recommends for hand washing. How often should I wash my hands? Every institution will have specific policies regarding hand washing. I'm going to teach you here what the CDC has to say about this. They say that healthcare providers should practice hand hygiene at key points in time to disrupt the transmission of microorganisms to patients, okay? So we should be washing hands before patient contact, okay? And we should be washing hands after contact, especially with blood, body fluids, or contaminated surfaces. And this is even when gloves or gowns are worn, okay? We always want to fully wash our hands before any invasive procedure. So for example, before you would start an IV on a patient, before you would give an injection, before you would maybe do a wound dressing change, it's very important to fully wash hands. So after we remove our gloves, wearing gloves is not enough to prevent the transmission of pathogens in the healthcare setting. The microbes can easily get through the gloves and be on our hands, especially if our gloves get wet. So those are all the cases where we need to be particular about doing a full hand washing. Hand gel use is also proven to be an effective way to prevent the spread of infection. We can use hand gel in between patient contacts, okay? However, it's important to be able to differentiate when I should be using soap and water and when it's okay to use the hand gel, right? So, when should I use soap and water? We definitely want to use it when our hands are visibly dirty, when they're soiled with blood or other bodily fluids like stool or urine or any drainage from a wound. We want to wash our hands before eating. We want to fully wash our hands with soap and water after using the toilet. And we have to fully wash our hands when a patient has a diagnosis of C. diff. We're going to talk a little bit more about what C. diff is in our next session. Let me give you an example. Let's say you're on the unit and you go into a patient's room because they put their call light on and they ask you to pour them some water. So you go into their room, they're not on any type of isolation, they don't have any type of an infectious disease, and you go in the room and you pour them some water. And then you are exiting their room, and as you exit their room, you notice that the call light's on in the room next to that individual. Now, you want to go into that individual's room to help them as well. Is it okay to just use hand gel? Yes, it is. Why? Because you were not exposed to any bodily fluids, and you went in, you helped that individual, you weren't exposed to any bodily fluids, you weren't going to lunch right now to eat, you were just going into another individual's room, and it's okay to use hand gel between those two patient interactions. Okay, so that's a good kind of an example of when you might be able to use hand gel. Usually, if I have about 3 patient interactions like that where I've used hand gel and I've gone into 3 different rooms using hand gel because it was okay to do so, then I might go ahead and do a full hand washing before I continue back into the care environment. So those are just kind of good rules of thumb to consider and follow. Okay. So we said we were going to talk a little bit about Clostridium difficile. This is a bacterium that causes inflammation of the colon, also known as colitis. And the people who are at greatest risk for acquiring C. diff are patients who have other illnesses or conditions that require prolonged use of antibiotics. So our elderly kupuna that we care for in long-term care are at high risk for getting a C. diff infection. So C. diff is an infection in the patient where you absolutely must do a full hand washing before you go into this patient's room and after caring for this patient. So if you have a patient with C. diff, you are not permitted to just use hand gel. Okay? You must fully wash your hands before entering the room of another patient. Okay? Symptoms of Clostridium difficile include watery diarrhea, at least 3 bowel movements per day for 2 or more days. They may have a fever, loss of appetite, they may feel nausea, they may have abdominal pain or tenderness. People can become infected if they touch items or surfaces that are contaminated with feces and then touch their mouth or mucous membranes. What I mean by this is that you may not see this. This is microscopic. I mean, nobody would actively touch stool and then knowingly touch their face or their body after that. But what I'm saying is it's very easy for healthcare workers to spread this bacteria to patients or contaminate surfaces through hand contact, and we don't even see it. It's not visible to us. So this is a highly contagious bacteria, and it can be life-threatening. So we want to make sure that we're very careful when caring with individuals with C. diff. And so when we even suspect that one of our patients might have C. diff, before we have a definitive diagnosis, maybe they're having multiple watery stools in a day, we might automatically just put that patient on isolation and go ahead and keep that patient on precautions because we're anticipating that they may have it, right? So C. diff can be life-threatening. MRSA is another type of problem that we run into in the clinical setting and in long-term care and other settings. It's a type of staph bacteria that is resistant to certain antibiotics called the beta-lactam. So examples are penicillin and amoxicillin. And you know, MRSA in the community, we do have lots of different MRSA infections. Usually they're skin infections, infections that happen maybe after a bug bite gets infected. And more severe or potentially life-threatening MRSA infections can occur among patients in the healthcare setting, right? And so these skin infections can appear as pustules or boils, which often they're red and swollen and painful. They might have like a purulent drainage, which is more like a yellowish drainage, a brownish drainage. Might look like a spider bite or a bump that's red or swollen and painful. And we will take some time to have a look at what this infection might look like in the next couple slides. They commonly occur at sites of visible trauma like cuts and abrasions, areas of the body that are covered by hair. So sometimes you'll have like a man might get a little infected hair follicle like in his face from shaving, and that might get infected with MRSA, which might turn into like a major abscess, right? And so here are some examples of what MRSA infections might look like. And so you can clearly see here that you've got a lot of redness, you've got a broken skin that looks like there's drainage coming out. It looks hot to the touch, and it can be very painful as well. So these are things to be on the lookout for, things to be on the lookout for. So that is all for this section today in covering these important topics about bacteria, hospital-acquired infections through poor practices, not hand washing good, and not following policies and procedures on infection control. We are going to spend some more time next time getting into isolation and how to care for our patients once we do know that they have an infectious disease and we have to keep them separated from others. So until next time, have a great day.